Hi, everybody. Welcome to day 9 of my 30-day Facebook Live Language Facilitation Challenge. I'm here to talk to you today about a huge topic, which is autism and language facilitation. So it's a really great pleasure to be with you today. Thanks, I see people are joining, and I'm so happy to have you here today with my 30-day Facebook Live Language Facilitation Challenge. And like I said, today we're talking about autism, and I had to do a lot of thinking about the best way to talk about autism and language facilitation. And so what I did was I wrote up some notes, and I have 5 key things that I want to do with this topic to make it really functional for you, whether you are a parent of a child with autism or you are a parent who has a late talker and you suspect they have autism or someone has told you about it or any of that. So here's the 5 things that I'm going to talk about in this live video today. Thanks for joining me, you guys. All right, so the first thing is I'm going to tell you 2 reasons why so many children are being diagnosed with autism. And then I'm going to tell you 2 reasons why I think so many late talkers are being diagnosed with autism based on checklists. And then I'm going to tell you 2 reasons why it is so important for parents to be a child's primary language facilitator if you are, if your child is on the spectrum or you have that diagnosis. And I'm also going to go through a sample checklist, one that I pulled off the internet about, the checklist signs if your child has autism. And I'm going to go through that with you in this video to explain to you, how to identify the root cause of the symptoms in that. I see that there's some likes about that. And then also I'm going to tell you how that exercise that we're going to go through right here on this live video, I'm going to tell you how that exercise is going to help you become a language facilitator, a better language facilitator immediately, just by going through that, no matter what diagnosis your child has. So, that's a lot of stuff we're going to cover. I just want to say thanks for joining me. Anne is here, and Anjan is here, and Jesper's here. Thank you so much for joining me today on my live. This is day 9 of my language facilitation, my 30-day Facebook Live challenge, where I want to explain to parents all over the world how important it is that you are your child's primary and best language facilitator. And today we're talking about working with children who look like are diagnosed with, any of that about autism. So we're talking about autism and language facilitation today. Thanks. If you're just joining me now, you're going to be able to catch this. I just realized it's being really loud. If you're just joining me now, you can catch all of my 30 days, including this one, here on my Facebook page. All you have to do is hit the notifications button, and then you'll get notified. And if you're catching this on YouTube, I do have a YouTube channel now. So if you've missed any of the other episodes and you don't want to scroll through the rest of my feed to find all the videos, or you want to see them in order, or you want to pick out the topics that are relevant to you, that YouTube channel might be the best place for you to do it. And all the videos get up there within 24 hours of my live broadcast. So that's where to find them. All right. Let's dig in and start talking about autism. All right. I forgot to tell you who I am. My name is Marcy Melzer, and I am an intuitive speech-language pathologist. And I help parents teach their late-talking children how to use the words they need to share their wisdom with the world with my Waves of Communication parent coaching program. And this 30-day live is all about it. So if you are digging this 30 days, if you have any comments about any of the stuff that I'm going to talk about today, please put it in the comments here. You can also contact me and share. You can contact me via private messenger here on Facebook, and we can have a chat. And then I also do offer free language facilitation strategy sessions for any parent of a late talking child who you want to talk about your child's current situation and see if maybe a Waves of Communication customized plan is for you in our program. We can talk more about that later. Right now I got to talk about autism. All right, so let's see. All right, so we're going to get started. The first thing I want to do is talk about two reasons why so many children are being diagnosed with autism in the first place. I just heard on NPR yesterday that the number has gone up, that it used to be 67 or 68, and now it's at 55. One child in 55 on the planet is being diagnosed with autism or autism spectrum disorder. And so it's happening, and it is what it is. And that is literally 1.8% of the population of children. So here's my idea about why it's happening, because that's, whenever I talk about this, autism is a topic that I talk about quite a bit, because obviously there's a lot of kids who are receiving that diagnosis around. And sorry, my nose is itching. All right. And anyways, so if with that many children being diagnosed, here's two reasons I think it's happening. First of all, we know that between 10 to 20% of the population of children between 18 months and 4 or 5 years old demonstrate late talking. So they are speech delayed for one reason or another. 10 to 15 to 20% depending on age, but let's just ballpark it at 15%. So if more than 1 in 10 kids is showing late talking, basically they haven't met their communication milestones. 1 in 10, more than 1 in 10. And late talking, so that's the first reason. And the second reason is that late talking is the primary indicator for most autism or ASD diagnoses. So that's it. I mean, that's it right there. A lot of kids aren't using words to communicate for a lot of different reasons. And what's happening is every single time a child presents with late talking, the bias is going toward getting a diagnosis, because what happens is the system says, you have a child who, is suspected of having autism because they meet these checklists on these criterias. And, that's what's happening is they're just going ahead and seeking a diagnosis because that's what they're told to do. Once you suspect something, like, I suspect I have appendicitis, you go to the doctor to check to see if it's appendicitis. But so what's happening is so many children are late talking for all different kinds of reasons, but because late talking is the number one reason that people think of autism, or they think autism because of late talking, I think that's why the number's so high. And so literally all these families, which is more than, 1.8%, but I mean, 1.8% is a huge number of children. So anyway, that's what I think is going on. And like I said, the message that I looked at on Easter seals is, if you suspect your child has autism, then go get a diagnosis and go get intervention right now. Because, see, the thing is, autism is a real significant neurological cognitive problem. It causes real significant issues. And if a child truly does have autism, it's very important that they have intervention early, and you as a parent have guidance from people who know about working with children who have autism. But if we're calling kids autistic just because they're late talking for other different reasons, that's a problem, because just like if you look for appendicitis and instead of really finding out that your gut ache is caused from something else, you go ahead and have the appendix removed, that's going to, first of all, be very invasive to your body, and second of all, not even address the issue. And so that's the problem, is suddenly the same kind of urgency for structured intervention that goes with an autism diagnosis for a child who's truly autistic, it's really important that that happens. And so here's why it's happening. You know, the first issue, like I said, is that business of you know, making sure that the diagnostic indicator is late talking. But the second thing is here, what it is. So because so many kids are late talking and autism has such a big voice, the only insurance reimbursement and the only school programs, government programs, things like that, that are funding services or therapy are able to do that because of an autism diagnosis. So if your child's late talking and you want to get help or a therapy or a program or whatever was suggested to you by the person who said maybe your child has autism, or maybe it was even another mom who said, I don't think my child has autism, but I got this program for free because I got him a diagnosis. So that's why it's happening, is because all of these people are late talking, and many are programs that serve kids with autism do serve kids who are late talking too. But the problem is, so many of the kids who are late talking aren't necessarily late talking because of autism, and the programs that they're being funded or their parents are enrolling them in don't address the issue. It's kind of like going for appendix surgery without having appendicitis. In kids who are late talking because of physiological or emotional or, you know, for some other reasons that aren't autism, one of many, then the treatment to address any of those issues needs to be appropriate to address those issues. So anyway, we're getting into the next topic, but that's the first one. Those two reasons. First of all, late talking is identified, or autism is identified by late talking, and there are a lot of late talking kids. That's the first reason. And then the second reason is that there are more free reimbursement, free programs and reimbursement available for therapy and treatment available if you have an autism diagnosis. These are just the facts of why it's happening. These are why I think that it's happening. All right, so the next thing that I want to talk about today about autism is about why I think so many kids are being misdiagnosed, or why I'm trying to avoid using that word misdiagnosis, because here's the thing. It's happening. So your child may have an autism diagnosis, whether they have autism or not. And so the purpose of this video is to let you know that no matter what your child has, you know, here's why. Because some of the parents that I've talked to on the phone have said to me, I don't understand why these professionals will tell me that my child has autism when they don't necessarily have autism. And and I tried to figure that out, and that's why here's what I'm going to tell you I think is going on. There's two kinds of evaluators that are looking at this issue. So we know it's a fact that people are seeking diagnosis, because Easter Seals and Autism Speaks and your pediatrician and everybody on the planet says, if you think that your child has something, go get it diagnosed so that you can know what to do. That's the caveat. But most people just say, go get your child diagnosed. And so there are lots of professionals, developmental pediatricians, neurologists, speech pathologists, schools, you know, who are doing this diagnosis by profession. That's what they do. And In my experience, I have encountered parents who have been received diagnosis from two different avenues. So some diagnosticians use checklist and standardized assessment tools because they work in systems that require data. And a standardized test is one that says your child gets a standard score of XYZ, which puts them in the mild, moderate, severe. It's what we're taught at school to use as standardized tests. Those tests are developed from norm data, comparing children who are in a similar demographic, age, English speaking, Spanish speaking, different like that. So those tests were generated to provide standard tools to assess things like autism. And there are rating scales, like the CARS, you might have heard, I can't remember, the different standardized testing tools. And the way those tools work, because they're standard, is that the testing tasks have to be given in a very specific, regimented way. In order for the test to be valid, the evaluator has to give the test in exactly the same way every time. And the evaluator has to score the child based on the same criteria every time. That's how they get a normed sample, a standard score. And then there are other evaluation tools that are more checklist, where it's not so much dependent on the numbers, but if your child has so many characteristics in the plus column or the minus column, more in the plus side, then they tend to lean towards the tendencies for an issue. More in the minus side, no, probably not now, or evaluate later. So those are the kind of testing tools that schools use because schools need data. Insurance companies like tests like that. Any government program like early steps, early intervention, disability programs, all of those diagnostic, rigid diagnostic, structured, norm reference, standard, data-based evaluation tools are going to be necessary for any of those reimbursement tools. That's how they prove that kids who do poorly on these tests do better with this kind of intervention. So when you have your tools, I see a lot of likes about that. So you're understanding that that's how those testing things work. And that's how it goes. Now, the other kind of testing that happens is what's more like a comprehensive sort of testing, a holistic kind of testing. And that's kind of like Dr. Christine, or, the neurodevelopmental pediatricians, developmental pediatricians who they may use those tools to assess IQ or things like that, if that's what they're looking for. But in those kinds of diagnosticians' practice, they look at the whole child. So they're identifying the root cause of what's going on. And it's not a score that tells them, oop, your child got a 22 and out of a 25 scale, that means they're right on the edge, or the score doesn't mean as much to them as does evaluating the child's behaviors and what led up to those behaviors and their entire physiology, history from birth on. It's really important if your child has a number of different kinds of things going on, in addition to late talking, that's definitely the route you want to go. If your child is otherwise super healthy and not using communication, a speech pathologist can do that kind of diagnosis. But that's not going to be a child who you're necessarily looking for autism, because, if late talking is the only issue. But here's the other problem. Late talking is never the only issue. Because if you're not using words to communicate, you're using something else to communicate. So you're using behavior, or you're using gestures, or you're using signs or pictures, or something else. And in a lot of cases, kids are using behaviors that are undesired. They're screaming, they're banging, they're hitting, things like that. that parents don't like to see. And sometimes they are, retreating into their own selves because of that diagnosis, because of that physiological issue. So, for example, it's an ear infection issue and a child has had a lot of head pain, they're going to be withdrawn. And a checklist person is going to see child is withdrawn, and and a person who is looking at a whole child is going to see, oh, the child is not only withdrawn but also hasn't been able to hear and has been in a lot of pain. It kind of makes sense that they might be withdrawn. So, sorry, my nose keeps itching. Somebody must be thinking about me. Anyway, so like I said, that's kind of why I think that late talkers often get diagnosed with autism, because not only are they late talking, but they have other things going on. And if they're not social because they enjoy time just with people who understand them more, then they aren't going to engage with an evaluator. And if an evaluator only has the structure of a standardized testing tool to go by, and your child isn't in the mood to participate with a stranger in a strange environment doing strange things that they've never seen before, then they're not going to perform the task and they're going to look poor. They're going to look poor on the test. Any kind of standardized test, any late talker is going to do poorly on a standardized test because they either are not performing because they're not communicating, or they're not performing because they just don't even care or are interested or are, into the activity, because if it isn't fun, it isn't fun. And that's just kind of how it goes. But here's the other thing that is a tricky thing that a lot of evaluators, especially evaluators who go by the books, that use the data, don't take into consideration. Because a person who does a holistic evaluation, they use their criteria instead of numbers. They use what's called the DSM-5, and that's called the Diagnostic and Statistical Manual of Mental Disorders, the DSM-5, and it was updated in 2013 to describe autism with some caveats. And sometimes professionals who have been in the autism game or the autism evaluation system for a long time didn't really adopt those extra caveats, which exclude many late talkers from that autism diagnosis. And I'm going to tell you what those are, because if you do have a child who has a diagnosis of autism, but you don't really think that they are, or you got the diagnosis for whatever reason, here are some things that when you do receive a diagnosis, there's two things that need to happen. First of all, they need to say whether it's with or without an accompanying intellectual disorder, because they can have autism traits, but they have to see if there's also an intellectual issue too, which is what I have parents kind of try to weed out by their ability to follow directions and things like that. And then they also need to identify if they are with or without a language impairment, because there are children who are autistic without language impairment, who are completely verbal, but do display the autism characteristics, things that would qualify for them for the diagnosis. So you can have autism without a language impairment, but obviously the folks that I work with are late talkers, so that's the issue. And the children who display autism without language are more prevalent than those who do talk. And then they also need to caveat whether it's been associated with a genetic disorder. So if there is a genetic disorder like Down syndrome, which is very easily identified, and a child is also diagnosed with autism, that that doesn't necessarily fly according to the DSM, because I guess they can get the diagnosis. So you can have autism with intellectual issues, autism with language impairment, autism with a genetic condition, or autism with an environmental factor, or autism with catatonia, which is a catatonic state where they're not responding at all. And the other thing that happened in 2015 is that in addition to showing the symptoms of the late talking with these other issues, here are some specific things that kids must show to get the true autism ASD diagnosis. They have to have at least 2 types of repetitive patterns of behavior. I'm reading off my notes. I got these notes from the DSM-5 that was quoted on the Autism Speaks website. And I'm going to put the link to these characteristics in the description for this after the video. So if you're watching the replay, excuse me. So if you're watching the replay and you want to see where I got these characteristics, I'm going to give you the link to the Autism Speaks website so you can see where they say it is. So anyway, they also say that there has to be at least 2 types of repetitive patterns, including stereotyped or repetitive motoric movements. Those are the things that you would describe as lining up things, spinning things, flapping, repetitive moving, jumping, things like that, or even repetitive vocal patterns, okay? So they have to have 2 to be characterized on the autism spectrum. Also, they have to have insistence on sameness or inflexible adherence to routine. Now, we're talking about insistence and inflexibility. That doesn't mean I get used to doing things the way I like them. That means that if it doesn't happen this way every day, I'm inconsolable, okay? Now, sometimes that can be tricky to discern, but that's something that you have to use your intuition about. The other thing that requires a required characteristic for an autism diagnosis, according to the DSM-5, is highly restricted, fixated interests, okay? Now, highly restricted and fixated are different than obsessed with, I love and never want to stop doing, okay? Again, I know it's kind of a tricky situation to tell which is which, but think about the difference between, you know, if you have a warning, I know it's hard to be able to do this, but if you're able to distract your child with something else, if you're able to calm them down, if you're able to get them over doing their favorite thing and move on to something else, sometimes that doesn't qualify as persistent, okay? So remember, these things have to be present and persistent, which means that they happen across all areas, not just new, unfamiliar, and emotionally different kind of situations. If your child is able to transition from one activity to another with you when they are calm, then that disqualifies them from this characteristic. So the other thing is hyper or hypo reactivity to sensory input, or an unusual interest in sensory aspects of the environment. So that's kind of a tricky one. That's where the sensory part of the autism diagnosis comes into play here. And the only thing that I can tell you to think about it with your child is Is this an activity that they are obsessed about, or is it something that they are interested in? And again, we're talking about the difference between obsessive and interest. And what is it about that thing that they are interested in? If they're interested in dinosaurs and they know 500 different kinds of dinosaurs and every dinosaur name, but they don't know 3 farm animals, that doesn't mean that your child is, that just means they love dinosaurs and they don't care much about farm animals or fruits or whatever. I mean, I've met kids who have vocabulary, they know every state and every capital, but they don't know how to ask for, food. So just because they're interested in it and super interested in it doesn't mean that they can't move from it, because if they can move from it, then you know that it's not always persistent, okay? It's just a matter of finding a way to get them to move from it on a more consistent basis. Okay, so that's what the first 2 things, which are the biggies. Why so many kids are being diagnosed with autism and why so many late talkers are being called autistic when they could be late talking from other things. I hope that's okay. If you have any other questions, please put a note in the comments because we're digging in. My name's Marcy Melzer. If you're just joining me now, thanks for hitting up my 30-day language facilitation challenge here live on Facebook. And we're moving forward talking about autism and language facilitation right now with number 3, which is 2 reasons why it is important for parents to be the primary language facilitator for a child who has these characteristics, who looks like an autistic child, whether they're autistic or not, a child who has displays those characteristics. So here's the things that that you need to know about. And first of all, it's all about connection. And this is why language facilitator parents are important. Kids with autism, they do connect with the things they connect with intensely and well. But the things that they don't connect with, they don't connect with well at all. And you as a parent are the one who they're going to be able to connect with the closest. You've got that connection coming in from birth. And so even if they're not using words, if they're not using whatever, you are the one who's able to get into where they are intuitively, connect with them, get on their level better than anyone else. I know that there are parents who have told me that it has taken months for their interventionist, even if they come to their house, it's taken months for them to even connect, to play together. The interventionist just wants to come to your house to try to play together and help get your child to do more interacting and all the developmental skills they're supposed to. But if your child is running in the other room or attached to your leg the whole entire time, that's because they connect with you and not with these new people. And that's why parents, it's very important that you are the ones that are working on language facilitation when your kids have that behavior. Okay, and then the other thing that you need to know, that the reason that you are the best at language facilitation is because you know how to make it fun. You know what your child loves and what your child doesn't love. As a speech pathologist, when I came to family's house, I brought a bag of toys. I had to, at the beginning of the week, try to guesstimate for 30 different kids I saw that week. What's Joey gonna like? What's Sammy gonna like? And have something for everyone kind of in my bag. As a parent, you have what you need at your fingertips because your child tells you what they love every single day. And you use those things to be able to facilitate language. And so that's why it's important, that's why parents are the best at language facilitation, especially for a child who is so closely intuitively connected with their parents that they don't want to connect with other people outside. And kids who have a diagnosis of autism, the 2 things are, language and that connection. And anyone besides you, so many parents tell me that they have amazing, beautiful connections with their children. Their children stare them in the eyes and dig into their mind almost. They sing and laugh and cuddle and have wonderful connected times. Now, they might not involve much language, and they might not happen all day, every day. They certainly happen on the child's terms. But, just because those things don't exist for other people doesn't mean they don't exist. And you as a parent are the ones that can help bring your child and help them be able to share that love and wonderful wisdom and spark and spirit with everybody in the world, and not just you. And you're the ones who are able to help them do it. So, let's see. All right, moving on. Number 4. This is going to be the fun part. This is the activity where I am going to go through with you a checklist for if you suspect your child has autism, or if your child is a late talker, blah, blah, blah. This is one of those. And this comes from the Easter Seals website, okay? So what we're going to do is I'm going to go through, they have social communication and interaction category, and they have restrictive and repetitive behavior category. So what they say is basically if your child has these characteristics, then you definitely should go get an evaluation. And so what we're going to do is I'm going to go through each one of these, and I'm going to tell you quickly how it can be related to something besides autism, just in case. How it could be related to autism, but it could be related to something else. So let's start with the restrictive and repetitive behavior category. Because remember, we talked about in the DSM, you have to have that restrictive or repetitive behavior, and you have to have 2 of them. And remember, they have to be persistent. So not just I saw this one time and I saw this other one time. It's 2 different characteristics that happen persistently. And I'm going to tell you how each one of these could happen from something else. So remember, if it's caused from something else besides autism, and you stop the cause of that something else, then you stop the repetitive behavior. So here's the reason. All right, we're going to start with the first one is stereotyped repetitive speech, motor movements, or use of objects. Whoa. Okay, I'm going to split that up even. The first one is stereotyped or repetitive speech. The first reason that kids use stereotyped or repetitive speech that is not because they have autism is because they have been taught stereotyped or repetitive speech. So if your child was given a diagnosis of autism and then put into a program where they're learning PECS or some kind of ABA where they are learning structured, phrased, scripted sentences for requesting, I want blank, 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 please. You're going to see kids who use those kinds of phrases to request the things they want, but you're also going to see them use scripted phrases because these kids don't have autism. They just want to know how to communicate what they want. So they're using the phrases that they've been taught in therapy, but because they don't have any structured phrases for everything else in the world, it's kind of like learning a new language and not having anything but the phrase book to go by. So it's kind of like living your life by phrase book if you learn everything in a structured therapy. So what the kids do is they learn a phrase that has worked for them in the past, just like they learn I want juice has worked to get them juice. At one point they said something like Valerie's little girl who said, Old MacDonald, and somebody played her favorite song, Old MacDonald, and she was like, great, all I have to say is Old MacDonald and I get my favorite thing. So she started asking for everything using Old MacDonald because she was in the mode of learning scripted phrases. Now, she never even did well. She had exposure to that, but it was a strategy that somebody showed her, and Allie was actually trying to use that strategy herself, which is where those scripted phrases come from. So that stereotyped or repetitive speech behaviors, that may be learned. So the motor movements or use of objects in a repetitive way can be it works that way. So let's say you have a child who likes to chew on things, and they have, they chew on something for a while and they keep it for 2 months or a week. It feels like 2 months, but maybe it's a day. And they just don't chew on it. And then the next day they're chewing on something else. And you're like, man, all he wants to do is chew on things. Well, perhaps that could be because something's going on physiologically there. Or if a child likes to line things up, you have to think about why they're lining up. Many kids like to line up cars because pretty much every car thing has them lined up going to race. The whole Cars movie is about racing. What do? They line up and race. When you see the toys played on TV, they line up. Everything lines up. And not only that, but it's a good way to assess what you have to line up. So the girls will line up their ponies or their Barbies or their babies because they're like, it's like when you're going out on a date and you have your dresses or you're at the store and you are buying a new dress for a party and you line up the top 5 and you see, which dress do I like? I like this about this. I like this about that. And they might not be talking through all of that, but when kids line up stuff and they get down on the floor and they're evaluating things, that's what they're doing. It's not because they're lining it up to line things, as long as they do other things with those toys, as long as they play crash and burn with cars, as long as they put them in and dump them out, as long as they do different things, they don't play with a toy in one obsessive way, then you don't necessarily have to be concerned about those repetitive behaviors. All right. So, excessive adherence to routines. All right, now, late talkers, routines are their friend because just like if you're working on the job, you always know that at noon you're going to get fed and you're not going to be at 12:30. I wonder when the bell's going to ring. I wonder when it's time to eat. I wonder when it's whatever. You learn to adapt and then you know that at noontime you're going to be able to eat. Now, many parents, because of whatever reason, structure their lives in a way that their kids learn to depend on that predictability. So every day lunch is at 12:35, and then if lunch is at 1 o'clock, the baby's upset because lunch is late and whatever, and and all the baby has to do is just sort of get upset, and then food arrives. So what's happened is the family has used that timing and structure as the tools to compensate for the child's not using words to ask for the foods that they want. So it's not like I have to wait, till, I might be feeling a little hungry now, but I'm going to wait another half hour or so, food's going to arrive, and I'm just going to be fine with it. So a lot of late talkers just, because talking is hard for one reason or another, they just prefer to, let that happen. Now, if they get so set in a routine that, like you said, if you're a half hour late for lunch, they start to get upset, well, that almost looks like them not tolerating the routine instead of you being late for lunch. So if that situation's happening in your house, think about what's causing that. Is it you that's late for lunch, or is it your kid who is, just, I can't stand it if I don't eat lunch at noon, You develop a tolerance. All right, so another one that they talk about is highly restricted interests that are abnormal in intensity or focus. So the only thing that I can say about that is abnormal is based on I'm not sure what. So what normal behavior is for a child is about as diverse as their family, their environment, their interests, what they have available, their resources, all of that. When they say abnormal, if a child can play with a train set for 3 hours straight, a 2-year-old can play with a train set for 3 hours straight, but they refuse to sit and do a puzzle with you, that's not abnormal. That's preference. And a lot of kids who are late talking are super, super smart. And they live their lives in their head. And what they're doing with that train table could be so complex, especially when they're playing with sensory-related things, jumping, running, water, The things that preference. I mean, there's kids that can be in the swimming pool for hours on end and just be happy because in their head they're just in their mode. They're doing their thing. Now, is that abnormal or extreme intensity? I think if you can never get your kid out of the pool, if you are, I think about the babies who are so colicky and stuff. Parents have to drive around the block, to get them to be able to go to sleep, things like that, where you're doing that. If you're doing that level of problem solving with your child every day, then there's going to be a concern. But if it's, man, he just can't get enough of the train table, and I can't get him to do anything but the train table. And as long as he's not sitting in one place playing with one train, doing one thing for 5 hours, that's different. Even if your child isn't using very complex play, even if they just like to watch balls bounce, pay attention to what else catches their attention. Like there's a client that a language facilitator mom that I've been talking to, and her little boy is 9, and he's nonverbal, and he loves the balls, and his therapist is starting to use balls to bring him out of his environment. And he's starting to be interested in watching his brother play video games. And so he's broadening his horizons. It was a very simple world that he appreciated. But, his mom and his therapist have been starting to bring him out of that. And he's 9 years old. So, I think the deal is all about being able to connect and bring your kids out of things. All right, so those are the restrictive behavior category. Here are the social communication interaction characteristics that might suggest your child has autism, but could be caused by something else. And I see there's Colleen's watching. Hi, good friend from back in the day, practically my sister. And Jen is here. Thank you so much for watching, everybody, and joining me for my 30-day live. We're kind of right in the middle of this activity where we're going through an autism checklist and identifying how some of the things, or pretty much all of the things on this checklist, could be caused by something other than autism. All right, so as far as the social communication and interaction stuff, this says that the first one is difficulty establishing or maintaining back and forth conversations and interactions, okay? So, now, keeping and maintaining interactions with people is very heavily language dependent, especially if it's an unfamiliar person. So, a child who might display autistic-like tendencies can be avoiding people because they don't speak the same language. Think about if you had a semester of Spanish in high school and then you got plunked in Madrid. You would not be seeking out and making eye contact with everybody to make conversation with you. You're going to be avoiding people. You're going to want people to not talk to you too much because you're not going to be able to understand, and it's awkward. I don't understand. I don't know how to tell you. I'm going to start using gestures and, other stuff. So, it can really happen that it's difficult to have reciprocal communication when you don't understand people or you don't communicate well with them. So that's why parents sometimes will tell me that they do have interactions with their kids. They giggle together. They have games that they play where they even take turns. Their kids tell them to do stuff. I think about Allie, who points to things and points to her mom, like, you say this and I say this, and they have really nice back and forth interactions. They just don't involve language and conversation. So a child with autism is never going to be able to have those kinds of interactive. That I know that you know what I'm talking about, kind of eye contact stuff. That's the interactive, reciprocal kind of communication that this is talking about. And ear infections and hearing loss is a big one that's going to cause people to not be able to do, because if you can't hear what someone's saying, if you can't understand them, you're not going to have. And if you have trouble vocalizing what's going on, then you're going to have trouble too on both ends. And if the communication doesn't flow naturally, then you're going to want to avoid it. And that's kind of what happens there. All right, so here's the one thing on this whole checklist that I see as being a characteristic of autism, and that is the inability, and I underlined it because that's the thing, is the inability to initiate interaction. And that means your child never comes to you to tell you what they want. Initiate means I need something. I want to tell you something. I'm coming to you to bring you a toy, to grab your hand, to yell at you. You know, a child with autism is not going to be able to know. They're just going to stay in one place and make noise and hope someone comes to the rescue. You know, or not even hope someone comes to the rescue. That's how it has to go. So that's going to be the thing, the one thing that in this whole checklist that is going to be the ticker. And that's not enjoying. That is not able to, inability. So if your child doesn't ever let you know what they want, then you can be thinking about autism. So, moving on. The next one, problems with shared attention, or joint attention is what they call it sometimes, or sharing of emotions and interests with others. And we already talked about this. If your child's making eye contact with you, if they're joining with you, if they're loving with you, and they're not loving with other people, that's okay, because at least they're loving with you. And if they're selective with who they love, that just means that they're smart and they're protecting themselves from having to be in a situation that's uncomfortable for them. Okay, now, how you work them into that is a whole different story, but that's what's happening. All right, so here's the big one. Abnormal eye contact, facial posture, facial expressions, tone of voice and gestures, as well as an inability to understand these. So, eye contact. Like I said, your child may be using eye contact great with you and not with other people. Facial expressions. Late talkers are amazing at using facial expressions to tell you what they want. They can, they're incredibly good. They're practically mimes. They can tell you when they're happy versus sad, and they can turn their emotions on a dime. If you have a late talker like that, I'm sure you understand exactly what I'm talking about. They can be like, here's your thing. Okay. I mean, these guys are so good at using their facial expressions to tell you what's going on. And a child with autism just isn't going to be. And also a late talker is going to understand yours. So when you give them that look like that, I see you, I know what's going on, and they give you the look, and then they turn around and keep coloring on the wall, they understand you. This is a preference time, okay? This is a situation that, is a whole different than a non-comprehending. Your child gets it. They just aren't complying because for whatever reason, they're in that mode. They're enjoying what they're doing because if it isn't fun, it isn't fun, and stopping's not fun. All right, so the other thing is gestures. Kids who our late talkers are amazing at using gestures. They use all kinds of gestures, and they understand your gestures too. And, they're going to be super good at all of that. And this particular checklist lumps eye contact on top of all of those other things. When they talk about abnormal use of gestures, that means ineffective. So if your child is trying to get you to do something and they sit in one place and go like this, that's not going to be very communicative to you. But if your child wants you to know what's going on, they're going to let you know. And if you can't figure it out, they're going to let you know that it's your fault that you can't figure it out, because they're doing their best to try to communicate it to you. So, all right, so that's it. And then, the last one is, difficulties in pretend play. So this is something also that late talkers have a lot, because they don't have the regular language structures for pretend play. When you play with the puzzle or flashcard, you have cow, here's the cow. Pig, here's the pig. Dog, here's the dog. When you play in pretend play, you have to have language like, hey, I'm Superman. I'm going very fast. Your Barbie has a beautiful dress. You have to have complex language to do pretend play very well. Even tea party play. It's my cup. Here's your cup. Ooh, that tastes good. That's all language stuff that these kids don't care about. It's out of their wheelhouse. Late talkers are using nonverbal, rudimentary, energetic, gestural, facial expression kind of talking. That conversational language, if they're playing with it, it might sound like da 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 da, or or they might again be using phrases that they heard from other things in other situations, because instead of doing their own pretend play, they're just scripting what they saw on TV. So the best way to get your kids to do pretend play is to pretend play with them. And a lot of kids who are late talking don't do a lot of pretend play. They don't like a lot of pretend play, again, because of that language. And even parents who try to do that with them, they're not ready yet. So that's another thing that I do with the program, is help parents get to be to the point where, they can start to use things to overcome these issues. And, engaging in socially appropriate activities with your peers. It's pretty much the same as all the other reasons that you wouldn't want to communicate with your peers if you don't speak their language. And that's pretty much what's going to happen for all of these things. So we've been through, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 or so different checklist things that you would see, checklist items for your typical autism. Do you suspect your child has autism? So if your child is late talking and somebody told you about autism, because 1.8% of the population is being diagnosed with autism, if you think that, that's in your wheelhouse of what's going on, pull up one of these checklists and start going through each one, because that's the number 5 thing I'm going to do, is literally how this activity is going to help you. So this is what you're going to do. Go pull one up from anywhere, from Autism Speaks, from wherever place you want. This one was from Easter Seals. And go ahead and look through and identify each one of those checklist items and think in your head, use your intuition. Why is my kid doing that? Does he do it because he likes to play with toys that way? Does he do it because... Think about it. You're the one who's going to know best, okay? And then the other thing is to... where's my note? The other thing is to... when you address the root cause of the symptoms, like I said, if your child's, banging their head because they have pain, and you get rid of the pain, they're going to stop banging their head. Think about the root cause of what those things are and what kind of intervention you can do to help address those root causes. And then the other thing is that you should, where's my other thing? Oh yeah. When you replace the undesired behaviors. So if your child is screaming, or if your child is not participating with other kids because they don't like to, participate with other kids because they don't speak the same language, you'll be able to, when you understand that checklist, on the checklist, you'll be able to know which areas on the checklist you want to help mold, you want to help convert, because that's going to help you as a language facilitator parent in choosing the problems that you want to solve. Because if you see these red flag things, and they're things that aren't okay with you. I mean, if your child loves to play with trains, or your child loves to color and write numbers for 3 hours a day, and that's something you're cool with letting your child do, go for it. If you can spend 8 hours a day walking around in the woods and teaching your child that way, go for it. You know, indulge their obsessions and use them as tools to teach them. You know, don't stop the things that they're obsessed about in order to try to teach them things they don't care about, because you're never going to be successful. So, you know, because if it isn't fun, it isn't fun. And that's the whole bottom line. So, big video today on autism and language facilitation. Thank you so much for joining me. I saw people just popped in here at the end. Susan is here and Jenna too. Thank you so much for sticking it out with me and watching this whole video, getting this tip on how to use a checklist to actually become a language facilitator a little bit more effectively for your child. And if you have any questions or comments, please write them down below. I respond to all the comments that I get. And if you want to know how to help your child overcome these red flag characteristic autism things and start to use words, replace those nonverbal behaviors and start to use words so that they can share their wisdom with you, that's when you can get a hold of me. My name is Marcy Melzer, and I'm an intuitive speech pathologist. You can find more information about me on my website, wavesofcommunication.com. There is actually a free class there for parents, in addition to the 30 days of videos I'm putting out. So my goal is to share as much information as I can to get parents to be the most effective language facilitators as possible. And if you want to do a free language facilitation strategy session with me, if you have a late talker and you're just not sure what is going on and, you know, what are the causes for my child's late talking and want to become a language facilitator yourself and get your own custom plan, that's when you schedule a strategy session with me. And you can send me a private message, or you can go on the website and find a way to do it too. So thank you so much for joining me today. I'll see you tomorrow for day 10 of my language facilitation 30-day Facebook Live challenge. Thanks so much for joining me today, and I'll see you tomorrow.